Hi, I'm Dr. Chip Cooney from the Animal Hospital of Statesville. Today, we're going to spend some time talking about cranial cruciate ligament injuries in dogs and cats. We all know someone who has torn their cruciate ligament in their knee. This is the ligament that is very commonly damaged in athletes. Well, dogs and cats have a very similar ligament structure in their knees as people do, though their conformation is a little different. The knee is made up of two bones. The upper bone being the femur, and the lower bone being the tibia. The bones sit on two pads known as a menisci. The knee is kept from sliding side to side by the medial and lateral collateral ligaments, and from sliding forward by the cranial and caudal cruciate ligaments. The kneecap sits just under the patellar tendon and provides a mechanical advantage to how the knee works. The cranial cruciate ligament is damaged when the upper bone of the knee moves forward while the lower bone of the knee stays stationary. While any type of slip or fall can cause the injury, the classic model is a dog running through the yard and stepping in a hole. This causes excess strain on the ligament and leads to stretching or tearing of the ligament. This, then, causes pain and instability in the knee as the knee wants to slide back and forth each time the pet places weight on the leg. So what needs to be done if this injury occurs? Well, in small dogs and cats, often nothing. These smaller pets do not place the stresses on the joint and, given time, the body will stabilize the soft tissue around the knee to limit the laxity. But in most pets, surgery is required to give the best outcome. We know that if the cruciate ligament is torn, arthritis will ensue with or without surgery. Surgery is the best way to limit the arthritic change and ensure the best use of the lower leg over time, especially in a larger dog. There are several different ways to stabilize the knee after rupture of the cruciate ligament. The first is called extracapsular stabilization. It involves placing a large, non-absorbable suture outside the joint capsule to help the body limit the laxity of the joint. This is an older technique and works fairly well in pets less than 40 pounds. The next technique is called a TTA, or tibial tuberosity advancement surgery. There are several techniques to perform this surgery, but we're going to focus on the MMP technique here today. The MMP procedure involves cutting the tibial tuberosity just behind the attachment of the patellar tendon and using a titanium wedge to advance the attachment forward while placing a small bone pin and staple. Another common procedure is the TPLO. It involves cutting the tibia bone in an arc and rotating the tibia around the knee joint to provide the stability. It is a rather aggressive surgery and requires the placement of a bone plate and screws in the tibia. Both of these procedures use the patellar tendon to approximate the cruciate ligament, which stabilizes the knee. We have chosen to offer the MMP procedure in our clinic for several reasons. Number one, it is simpler to perform with less trauma to the pet's knee. Number two, it's quicker to heal with return to function in a shorter period than the TPLO. Number three, it gives long-term results similar to a TPLO with multiple articles showing minimal difference between the two. And number four, it's less expensive to perform, usually running about 25% less than the TPLO. We are now offering the MMP repair for cruciate ligament injury in medium and large dogs. We are confident in the procedure and find it to be an excellent option for return to function on the affected leg. Let us know if we can be of any assistance or if you need more information on this procedure.